How long does it take for a cat to show signs of leukemia? Feline leukemia virus, FeLV, is a serious and contagious disease that affects cats by weakening their immune system. This makes them more vulnerable to infections, anemia, and even cancer. One of the most common questions cat owners have is how long it takes for a cat to show signs of leukemia after exposure to the virus. The answer depends on several factors, including the cat's age, immune system, and overall health. Incubation period of feline leukemia virus, FeLV. The incubation period refers to the time between a cat's exposure to FeLV and when they start showing symptoms. This period varies widely among cats, but in general, some cats may develop symptoms within a few weeks to a few months after exposure. Others may remain asymptomatic for years before showing signs of illness. A few cats may fight off the virus and never develop FeLV-related diseases. FeLV has different stages of infection, which influence how long it takes for symptoms to appear. Stages of FeLV infection and symptom onset. Primary viremia, early stage. This occurs within weeks to months after exposure. During this stage, the virus enters the bloodstream and begins spreading. Some cats' immune systems successfully fight off the virus, clearing it from their bodies. If the cat's immune system cannot eliminate the virus, FeLV progresses to a persistent infection. Latent infection, carrier stage. Some cats may carry the virus without showing symptoms for months or even years. These cats can still transmit the virus to other cats. Stress, illness, or other immune system challenges may trigger the virus to become active. Progressive infection, advanced stage. Once the virus spreads throughout the body, it begins to cause serious health problems. Symptoms typically appear months to years after infection. Symptoms of feline leukemia. When a cat begins to show symptoms of FeLV, they may include heavy checkmark loss of appetite and weight loss, heavy checkmark lethargy and weakness, heavy checkmark persistent fever, heavy checkmark pale gums, a sign of anemia, heavy checkmark enlarged lymph nodes, heavy checkmark chronic infections, respiratory, urinary, skin infections, etc., heavy checkmark diarrhea or vomiting, heavy checkmark neurological problems, seizures or difficulty walking, heavy checkmark tumors or cancers, such as lymphoma. How to detect FeLV before symptoms appear. Since FeLV symptoms may take months or years to appear, regular testing is crucial. A simple FeLV blood test can detect the virus early. There are two common tests. ELISA, enzyme-linked immunosorbent assay, detects early-stage infections. IFA, immunofluorescent antibody test, confirms persistent infections. If a cat tests positive, follow-up tests may be needed to confirm the diagnosis. Conclusion. The time it takes for a cat to show signs of leukemia varies greatly. Some cats may develop symptoms within weeks, while others remain symptom-free for years. Regular testing and early detection can help manage the disease and improve a cat's quality of life. If you suspect your cat has been exposed to FeLV, consult a veterinarian for testing and advice.